All right, turning now to healthcare. As more and more Americans cannot afford procedures at their local hospital or maybe even sort of elective surgery, medical tourism is becoming an attractive option. David Boucher is the president of Companion Global Healthcare. It helps employers provide procedures abroad for employees. David joins us now with more. David, is this all necessary work or it can be elective as well?
Well, the members can choose to travel abroad for elective work as well. What we're primarily focused on really are non-cosmetic procedures like hip replacements, spinal fusion, heart valve replacements, procedures of that nature.
Okay, so we're outsourcing things like manufacturing, IT support, even jet wings now. And the next thing it sounds like is going to be healthcare too, right? Getting a new hip, you're going to go where? Mexico? Brazil?
Well, we work with hospitals. Hospitals in our network today are in Singapore, Bangkok, Thailand, places like Costa Rica, Ireland, Istanbul, Turkey, Taiwan. And the hospitals in our network are all JCI accredited, the same accrediting body that accredits U.S. hospitals. All of our hospitals have much higher nurse-to-patient staffing ratios, much higher patient satisfaction ratios than the average American hospital. And again, the savings are between 70 and about 90%.
So how does it work? So, let's say I'm an employee and I need a new hip, and it's covered under my insurance plan for my employer. I go to get health care, and they say, you know what, we're going to give you a new hip, Brian, but you got to go to Singapore to get it. I mean, is that literally how it works?
Actually, Brian, it's not about mandates. This is really about consumer choice. And generally what happens is employers will basically layer a benefit that may, for instance, waive co-pays, deductibles, member out-of-pocket amounts, and include airfare for their folks to go abroad. So it really is about a choice. It's not about forcing anybody to go anywhere for their care.
David, it's Dagan McDowell. I know that the numbers are really staggering in terms of the cost savings. If we can throw some of them up, because you sent us some that are just breathtaking. But it is about getting people past the reticence or fear of having a major procedure like a heart bypass overseas in a foreign land.
It is. You're correct. And I think, again, this is not a novel approach. There's hospitals in our network like Bumrungrad International in Bangkok, Thailand, that have been working in this with international patients. Last year, they treated over 400,000 international patients. These are procedures. Hospitals like Bumrungrad have over 200 U.S. board-certified physicians. They use Stryker implants, for instance, for their hip replacements and knee replacements, Pfizer drugs, on and on. And so, again, these are some of the hospitals that really are working with time-tested processes.
The numbers that we put up in that graphic, the savings were staggering. I mean, Dave, you're talking about literally, a 90% difference in some cases between $100,000 and $10,000 for a procedure. Let's call it a hip replacement and just aggregate, even if you call it 85%. I mean, do you think we'll get to a point where your work, your insurer or whatever, your workplace says, hey, you got to go? I know you said there's some choice here, but with those kind of numbers, it's, hey, hit the road to Mazatlan for the bridge work on your teeth.
That could happen, Brian. Again, the employers that we're working with, nobody's out there that we're talking with, are we hearing about mandates. It really is about choice. Perhaps, who knows, 10, 15, 20 years down the road, but right now it really is about choice. And again, we're not talking about mud huts with thatched roofs and rusty scalpels. These are more like five-star hotels, again, with U.S. board-certified physicians and really professional, top-notch care.
Are these all nations, really quickly, David, with national health care systems? So this is essentially a way for U.S. citizens to take advantage of countries that have national health care when right now we do not?
Not really. Some of the hospitals, for instance, like Bumrungrad International, Parkway Health in Singapore, they're publicly traded companies, so they are private facilities in these countries. But yes, you're correct. Most of the facilities that we work with are in countries that have nationalized health care programs.
All right, David Boucher, Companion Global Healthcare President. Interesting idea. I have a feeling with the economy the way it is, David, we may see more demand for services like yours. Thank you very much.
We think so. Thank you.